Dingalan A. Monta. I am from Group 4 of BSN 2A, and I will be your student nurse for today. So today, I will be showing you how to administer oral medication and how to withdraw medication from an ampule and how to withdraw medication from a vial. So first, I will show you all the paraphernalia that is really essential for the demonstration of administering oral medication and withdrawing medication from a vial and an ampule. Stay tuned! So these are all the essential paraphernalia that we are going to use for the demonstration today. So first and foremost, of course, we need alcohol to perform hand hygiene. Next is this cotton balls, the cotton ball with alcohol and a clean cotton ball for cleaning the area for the demonstration. Next, we have the ampule, the vial with sterile water, the syringes. Next is the medication cup, the medicine, the cardex or the card that contains the medication, the name of the patient, the room that is needed to be given for the patient, and of course, the medicine tray as we are going to give the oral medication to our patients. So now we are going to administer oral medication to our patients. Of course, these are all the needed paraphernalia for our patient. But first and foremost, of course, before doing anything else, of course, we need to check the cardex of the patient that contains the needed or the necessary things, which are the name, the medicine that is going to be needed, the room of the patient, and how many times it is going to be given to our patient. Of course, we need to go to the medicine cabinet and check the medicine that is going to be needed with the cardex, and then we will be getting the medicine that is going to be administered to our patients, and of course, the medicine cup and the medicine tray. So with that, assuming that I will be entering the room of my patient, we will not be opening the medicine. Rather, we will open this one when or once we're inside the room. So, for example, I will be knocking on the door and then I will be introducing myself. Hi, good morning, ma'am. Good morning, sir. I am Daniel Monte, your student nurse for today. And today po, papainumin ko na po kayo ng gamot. But with that, of course, we need first and foremost to confirm the identity of our patient with the wrist tag or the name tag of the patient. And if not, if we are still going to confirm it, we will check the IV fluid of the patient to confirm their identity. And with that, we need to ask the patient to perform NPI and then check if the patient is comfortable enough and if the patient can drink the oral medication that we're going to be giving to our patient. And with that, kung kaya naman, adjust the patient's position to a semi-Fowler's position with the adjustment on the foot side of the patient. And with that, alalayan na natin, and we are going to checking, and then we are going to be opening the packet of the medication. So our patient is Openia Maria Divine G. We'll be giving Immunopro 500 milligram, room 06. So as we opened the medication, we will be putting it to our medication cup. If there is no medication cup available, we will open the packet and then we will put it on the hand of the patient to avoid cross-contamination. But we should always remember that before giving that, we need to perform hand hygiene. So assuming that I have performed the hand hygiene before and when I entered with this alcohol. So I have already placed the medication here in the medicine cup, and we will going to give the medication to our patient. So assuming that I have given the medication to our patient, we will wait for a few minutes if the patient had already swallowed the medication that we have given to our patients. And if the patient had already swallowed the medication, if there are time that we can spare with our patient, we need to talk to them and observe if there are any other effects for our patient or any allergic reaction. And with that, after, we will be saying thank you to our patients. Ma'am, sir, thank you po. Tawagin niyo lang po ako kung may kailangan kayo. Again, I'm Daniel Monte po, and I have administered your oral medication. So now I will be showing you how to withdraw medication from an ampule. So first and foremost, we need to get a cotton ball with alcohol and clean the area of the ampule. So the medication ordered, it is for Malonda Malu O, furosemide 5 mg per 2 ml, room 212. In cleaning the area or the ampule, we need to start from the tip to the bottom so that we can avoid cross-contamination. And of course, after cleaning the ampule, we will open the ampule with the used packet of the syringes. So now I will be showing you how to withdraw medication from an ampule. So in breaking the ampule, we are using the used packet of the syringes and we will put it there. Always bear in mind to break the ampule away from you. And then dispose this properly. So now we have successfully broken the ampule and now we will be going to get the syringe. So it is essential for us to have a needle filter so that the bevel will not be used at the same time for withdrawal and administration because it will not be sharp enough and our patient will have a hurtful connection with us because of the bevel that will be not hard enough and it will be hurtful for them. So we'll now be getting or withdrawing from the ampule. So as per the medication order, furosemide 2 ml for Malonda Malu O. So it is essential not to touch the tip of the ampule at 90 degrees angle, 2 ml. It is essential not to touch the tip so that we will avoid cross-contamination. Okay, so now we have successfully withdrawn 2 ml furosemide from the ampule. With the scooping method, we will be recapping the needle or the syringe. And we will replace it, the needle. And now, the medication is ready and we will now deliver this to our patient. And now, lastly, I will be showing you how to withdraw medication from a vial. So we have finished the withdrawal of medication from an ampule. So now we will withdraw the medication that is needed for a vial. So from the medication order, it is a sterile water injection for 3 ml for Sergio Maricar, a 21-year-old, at room 112. So this is the vial. We will be cleaning it first with a cotton ball that contains alcohol. So prior to this, I have performed hand hygiene with the alcohol here to avoid cross-contamination from the middle. We're going to clean it around. So I have cleaned it. So as per the order, we will withdraw 3 ml from the vial. So it is really essential for us to change the needle with a needle filter because the bevel will not be sharp enough and our patient will be hurt by it. Remove the needle. And then change it with a needle filter. And then we will remove the cup. And then we will withdraw in a level area at the middle. And then flip it. Withdraw the needed amount. As per the medication order, it is 3 ml. So now we have successfully withdrawn 3 ml of sterile water and now we will be going to recap it through the scooping method. And then we will be going to change the needle because the bevel will not be sharp enough and our patient will be hurt by it. And now, the medication is ready and it will be going to be administered to our patient via IV. So after showing you how to administer oral medication, how to withdraw medication from a ampule and a vial, so I have learned a lot of things and a lot of necessary things that we need to always bear in mind, such as hand hygiene to avoid cross-contamination and to clean the area to avoid any infections. So with that, I have learned how to administer oral medication and how to withdraw medication from a vial and an ampule. Again, I am Dingalan Aldemonte from BSN 2A, and I hope that you learned a lot. Thank you!